So this is simulation-based learning using scenario-based learning. With me right now is fifth year students. There are three of them. First will act as a standardized patient. The second student will act as a first medical officer, and the third student will act as the second medical officer. So this is Jasveeni as a SP. This is Kamaleshini as a second medical officer, and this is Piriyaanka as a first medical officer that will clerk the patient. So, okay. The scenario is as follow. This is okay. This is one Divya, a 30-year-old Indian lady complained of fever and neck swelling since past 3 weeks. You are the attending medical officer, seeing her at the UK and MC outpatient clinic. So after she entered the consultation room, you want to explore more about her problem. So please take further history.
One Divya, you have no issues. Like before this, you've never seek medical treatment before. No admit, no, never required required to be admitted to hospital. I mean, only for delivery, but never see. Okay. Okay. So no diabetes or hypertension, nothing, right? Have you checked before? No. Do your parents have diabetes, hypertension, or anything? No. Okay. Have you done any surgery before? No. As in my parents, I was only my dad as a now. Yeah, whenever I have. Okay, so now for the past 3 weeks, before this, like maybe a few months ago or a year ago, like never had this kind. This is the first time having such a long fever, right? No cough. No. Okay. And then you were saying you were having some neck swelling. Can you tell me exactly where? At the back, you're having neck swelling. How long is that? For 3 weeks. Also 3 weeks. When did you notice it? How did you notice it?
Just right before I get the fever,
Mm.
I noticed that there was a small wound over here.
Like bathing time or combing your hair, like how, like what made you?
Maybe bathing time.
Okay, okay, okay. So okay, then but has it increased in size? It has increased in size. Okay, can you like do you know how much?
Mm, I mean, not really. Maybe about 20 size.
Now it's 20 cent. Previously
Smaller.
5 cent. So in the past 3 weeks it has increased lah. Increased. Okay. Is it painful? Even now it's not painful. Okay. Okay. Otherwise, do you have any night sweats? Do you have any loss of weight, like a lot of loss of weight? Okay. Besides this, anything else that is worrying you? Any other, like, do you want to tell me anything else?
No, just that I feel very tired.
You feel very tired. Okay. Ever since the past 3 weeks. Before that, it's okay.
Yeah.
Okay. Feel tired as in, okay, tell me more about what do you mean by feel tired?
Like usually I can do my house chores and everything, but recently I feel like I'm unable to do. I'm feeling very tired easily.
You feel tired easily, so that means even when you do a little, you're getting tired. Okay. Do you work?
Yeah.
Okay, what do you work as?
I'm working as a clerk.
Okay, as a clerk. Okay, so usually you go to work, then you come home and do the house chores. But nowadays you can't do that anymore. Okay, so the past 3 weeks also. Okay. Have you been falling sick lately? No, it's first time.
Only
It's first time. No cough, no flu, nothing. Okay. Have you been like getting like when you knock somewhere, or do you realize that you have easily you're bruised or something? No. Uh, do you have any past? Do you have any chronic illness? Like you've never undergone any surgery. So all you delivered all your children normal. Okay. How many children do you have? Okay. Well and healthy.
Yeah.
Okay. How, who, which years, like, did you deliver, like, I don't know, is it feminism? Okay.
You want to know?
Just how old are your children?
One is 7, one is 5,
Okay.
one is 3.
Okay. So no complications, huh? Post-op, during op, nothing, no issues. Okay. How about, what I would like to ask about your menses. Is it regular? Okay. How many days usually?
5 to 7.
And the cycle? 20. Okay. So when did you first get your menses? What age?
30.
30 years old. Okay. So from one. Okay. Uh, Otherwise, do you have any issues with your menses? Any pain or any no pain? Okay. Okay. Otherwise, do you have any during one cycle to another cycle? Do you have any spotting in between? Anything? No. Okay. When you're with your husband, sorry, yeah, it's just like that. Do you have any bleeding or pain or anything? Uh, I'm sorry, do you smoke or drink? Sorry. Does your husband smoke and drink?
No.
any allergy towards anything?
No.
Just how about going to toilet? Is it okay? Like normal? Any constipation? Any no problem? Huh? And then even passing urine is normal. Okay. Do you have any abdominal discomfort? No abdominal discomfort. Do you feel any like abdomen getting bigger or something? No? Okay. You have no issues. Like before this, you've never seek medical treatment before. No admit, no, never required to be admitted to hospital.
I mean, only for delivery, but never see.
Okay. 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 So no diabetes or hypertension, nothing, right? Have you checked before?
No.
No. Do your parents have diabetes, hypertension, or anything?
No.
Okay. Have you done any surgery before?
No. As in my parents, only my dad.
The next scenario is as you explored for the history of her problem, you suspected that she has alarming pathology of her lymph nodes.
She has a
And
pathology?
alarming pathology of her lymph nodes,
Okay.
neck lymph nodes, sorry.
Yes.
And you want to do a thorough examination of her neck. So please proceed to the examination.
Okay, for Divya, so this is my colleague. She's here. I've told her about your history. Now she would like to examine your neck lymph node. She's Dr. Kamala. Okay. Hi, one. My name is Dr. Kamaleshini, so I would like to examine you today. So, where's your swelling? Where's your hand? Do you feel any tremor? Yeah. This one. Straighten. Puan, boleh buka mulut kalian keluarkan lidah. Boleh, can you swallow? Can you remove your spectacles? Now I'll do just follow my fingers. Please focus on me. Just eyes move. Okay. Do you feel any pain? Okay, I will palpate. Do you have pains anywhere else? Swelling anywhere else? No.
The next scenario is okay. The first medical officer you are in the situation that you are not sure about the after taking the history and you do the physical examination, you're not so sure about that the problem of the patient, and you want to communicate with your colleague about the problem to ask her opinion regarding the patient. Yang ni yang result yang penuh lah.
So, Dr. Kamala, just now you examined the patient, right? Yeah. So, based on her history, she only seems to be having the fever on and off, and then the swelling which you noticed, right, at the back, her last supraclavicular region, there was a swelling, and also she said she complains of feeling fatigue. Otherwise, there is no significant history that I could elicit. I was unable to find. However, even on examination, everything she seemed to be fine except for the lymph node. Just the thing that concerns me most is that it is hard in nature and it's fixed, so it's like that's the thing. That is concerning me. Do you think it's anything for me to be worried or? She has been having it for the past 3 weeks. Any constitutions you have? She complains of loss of appetite. However, there is no loss of weight. Like, no loss of weight at all. Yeah, even her loss of appetite, it's patient is still able to eat and everything. Just that she feels very compared to before, it's less. That's all. So yeah. So, any travel history before? Travel, no. No travel, no diet of anything, no prolonged no family history of malignancy, nothing. Just that because it's supraclavicular, yeah, so it's making me think of maybe a gastric cancer. What do you think? Because what are you thinking of right now? Because I didn't. Any abdominal pain? No abdominal part. Yeah, okay. After we add in this, then so how we would like to move on, right? We do the baseline investigation because she has prolonged fever, right? Okay. So we should take a full blood count to check if she has any we can see for anemia also because she complains of thyroid. Yeah. And then ongoing infection, and then maybe ESR, any inflammation, and then otherwise she don't have any medical history, right? No medical history. So, no thyroid problem. Based on symptoms, she doesn't have any thyroid problem. Even on examination, the results seem to be okay. So clinically, seems to be okay. So yeah. So do you think you want to do any baseline investigation? Because we can do a full blood count because it's related. Yeah, that's related. Yeah. Otherwise, renal profile and she is able to take. She doesn't seem dehydrated. Everything. Yeah. So I don't think so. So maybe after we do the full blood count, maybe we can do a coagulation profile to see if there's any underlying blood disorder. In the case that we want to do a scope for her, we need to make sure that she doesn't have any coagulation issues, right? So, yeah. And then once I confirm with her further about the gastric symptoms, we can go for. If she has any symptoms, maybe we can go for a scope. Yeah. So yeah. Otherwise, do you think we need a biopsy of not for now? For now, it's growing in size. So it's painless. It's growing in size. Hard in nature. Yeah. Maybe we can take a neck biopsy. Right. Prefer to just take the tissue. Just to. Maybe we sort out until here. We sort out this one first. If this one is normal, yeah, nothing, no gastric symptom, proceed with biopsy. Yes. Okay. Then baseline renal profile and is for just for us to have a thorough picture of her condition. Then we can proceed. Yeah, just one as baseline of full because patient has never done a full examination before. No family history of malignancy. No family history of malignancy. Previously, she went She went to get treatment anywhere else before this? Yeah, before this she went to a private clinic, but then they just discharged her with Panadol and asked her, referred her to us. So yeah, so we are just proceeding from there. Maybe proceed with this first lah. We wait for the result first, then we talk further about the management. Okay. Okay. What do you think? Okay. Do we need to do any like ultrasound? It is a lymph node. It's so 20 cent size. Correct. And most likely we won't pick up anything.
Are you done? Okay. So that is the end of the scenario. For simulation-based learning, uh, after how can you improve from the in case of like you are doing a clerking practice, you want the input from the patient. So we will have the feedback from the patient. How do you feel about the clerking? I mean the all that lot of communication, sensitivity, empathy. Your lah. How can you comment?
Okay, I feel the mother was very soft spoken, and she did not ask any sensitive questions, or even if she did, she asked for information and asked back and say sorry first. So I feel it's okay.
Kamaleshini, what do you think during history taking interaction with the patients?
Interaction with the patient, I feel okay. It was a nice conversation. She was soft spoken, and then she could get all the history. Then she can rule out the differentials, what she can think of the next one, and prolonged infection.
For me, my opinion also. I know you guys are Piriyaanka. You are very well versed and already accustomed to history taking flanking. But I forgot to mention just now. Actually, I must stress that this is the setting of clinic setting. So usually during like in clinic setting we have a lot of patients, right? So we have time constraint to spend time with each patient. So but I mean when during the time constraint, um, how do you cope with that? I mean you don't want uh, to make yourself look like you are in rushing, and also at the same time you have to think of other patients that are waiting outside. So what do you think of? I think just now it's okay, but because I didn't tell you about the situation. More specifically, you have limited time on our. But it's okay. I think if I told you that you have limited time, maybe you will be rushing, right?
Correct. Maybe I'll be rushing. Maybe I
Won't ask unnecessary
unnecessary question, and I won't need to like things that are not relevant to the problem out. Then I'm asked, and also maybe we should get used to the idea that we will have limited time, because now we tend to clock a patient and rule out, but we don't keep time of it. Keep time. So yeah, I think that is the main issue.
And also during history taking, I think maybe the the mistake is because we don't really train a patient SP. So maybe just forget. Just now I heard that uh, you you said that patient didn't have a family history of malignancy. Uh, Jo- Jasveeni, you told the patient, doctor just now. No. But actually, in the history, actually, I thought that in the history, uh, the patient was told that her father told that
The
the
mother
mother
died due to
that
cancer.
cancer, but I'm not sure what kind of cancer.
Oh.
Ada kan? How do you feel the comfort and the showmanship, all that lah.
Oh, it was good, very gentle, not harsh or anything. And they asked for my permission before they do anything, so I think it's good.
In the rare setting, how do you expose the patient if you specifically you want to examine the neck until
Chest, up to the chest.
chest?
Yes.
It's okay. This is just Kamaleshini. Any comments from your observation?
I observed.
Sorry.
Ah.
Piriyaanka.
Yes.
Uh,
From the observation, I felt she did quite a thorough neck examination because not only the nipple but excluded also like thyroid and any other mass, and also did the whole general examination instead of just focusing at the neck, so we get to rule out as a whole.
yes.
So I think it was it was complete.
Complete lah,
Yeah.
almost complete.
Yes.
Yeah, I also noticed just now, although I mentioned the scenario is like
Just the
description
neck.
only the neck
Yeah.
focus on the lymph nodes, but you did all the examinations
Yeah.
that necessary lah. Like you want to rule out maybe thyroid malignancy
Yes.
or just now you put test
Any retrospective extension.
yes. But the techniques of examination of lymph nodes, how what can you comment on that? Maybe you can comment also. Examination, is it step by step? Lymph nodes. Where do you start first actually?
Submandibular.
Bawah.
Submandibular to go maxillary, preauricular, post-auricular, occipital. Then you go to your knee,
Anterior,
anterior,
anterior cervical,
cervical, and then posterior
cervical,
cervical,
and
and
then
supraclavicular.
scapular fossa. Any other things? I tak tahu nak komen apa. Rasanya okey je. Cuma nak elicit the rubbery consistency tu you buat macam mana?
Basically, when we fill the mass, then we must fill it up, define on our smooth surface, how the movement, and then the consistency we depending on the during presentation.
Ada dia fluid feel or dia ada hard
The
mass kan?
nature, yeah, cystic, solid, hard, firm, fluctuating.
Hard, we would just compare with forehead, very firm, soft.
Okay.
Any
Anything
skin
else?
changes, skin changes.
Skin changes, ya. Skin changes. Anything else ada yang missing tak?
Kalau thyroid supposed to do reflex test.
Yelah yang you buat semua tu kan? Thyroid. Okay, I think that's all for physical examination, and then your discussion, your communication with your colleagues, comment from each other lah. Particularly the one that the information that has to be conveyed, the one that received the information. What do you think?
Actually, I comment as a student. As a student,
Tak apa.
because we are new to this scenario
Yeah,
as a doctor.
okay.
So when she told me, okay, I can think of the differential. When she told me the history, she told me that like the important history she told me. After that, the only thing that we want to get to know more is about the gastric symptom. We want to know if there is it because of the mind. Otherwise, the discussion I feel macam like
Systematic tak?
systematic.
You punya, you rasa you dapat info tu, you dapat daripada information yang you receive, you can make your diagnosis daripada
I can
information tu.
come up with a differential. I cannot come up with one diagnosis.
Of course.
I can think of differential first because we need further investigation to come up with one diagnosis for now. Because the our history and physical examination didn't bring us to one point of diagnosis. So you want to do further investigation, then we'll come out. Otherwise, the history that I get from her is self-fit medical.
Did she suggest you provisional diagnosis?
She was thinking of gastric malignancy.
Basic malignancy. But of course, not sure which
Yeah, not
what
sure.
type.
Yes, yes.
So you further have to discuss the investigations that are necessary. So with regards to the investigations, what do you think that has a lack?
Investigation and
Actually, what you were thinking of?
Because initially I thought when neck when neck swelling, I thought of maybe like it can be infection or else, but usually infection because she has fever. So infection, but usually infection is more to painful, except for TB can be painless. But she didn't have any symptoms of TB that I asked, like weight loss, cough, like swell, like low shortness of breath, no respiratory symptoms, and then no constitutional symptoms also besides feeling fatigue. So then I thought that's why I couldn't confirm like even malignancy because she did not have any constitutional symptoms, but because of the supraclavicular node, lymph node, which is very characteristic of the gastric malignancy. So that's why I suspected the gastric malignancy. However, I should have elicited more gastric symptoms in my history too. So that's the only thing.
Okay. Okay. Among the differential diagnosis is infections, malignancy, what else?
Infection, malignancy,
hematological malignancy.
Pathological. Autoimmune, you think autoimmune?
autoimmune, did not think of.
But you still want to rule out?
Yes, yes.
Okay. And the malignancy, is it just gastric malignancy or you also think of other?
I thought of others also, like
Like
leukemia, lymphoma.
lymphoma,